our guest speaker. And hopefully more people join as the meeting goes on. So tonight we're going to do our seminar on understanding substance use and disorder. I'm Katie Thorne. I'm a health coach with Community and been with the network for about 5 years and am the health coach for Lawrence and the network as well. With me today is Matt Heskett. I hadn't even said it yet. Heskett.
Yes.
So he is joining us and he is going to lead us in a great discussion on substance use disorder. I'll let Matt introduce himself and tell us all a little bit about just where he works, what he does, and then we'll get into the seminar.
Okay. Thank you, Katie. So my name is Matt Heskett, and I am a part of Community Fairbanks Recovery Center on the business development marketing team. And I've been with Community Fairbanks now for coming up on 5 years. Ironically, it's also where I got sober as well. In 2015, I am a person in long-term recovery. And I'm a certified addiction peer recovery coach as well. I got that certification 3 years ago. And when I'm going through the PowerPoint here, we have some key points and statistics for you guys, some definitions and information on resources and things like that. And when I am speaking on this stuff, I'll be speaking on it from the point of view of just providing you guys with information and resources in terms of where to get that stuff, connections, and if anything is regarding Community Fairbanks or community health as a whole, like the processes and procedures. And then just from my experience as well, working, firsthand on the floor and inpatient for a little over a year, and then my work now and in a person in long-term recovery. So I'm not speaking on anything from that clinical point of view because I am not a licensed clinician. It's more just from my experience, the procedures that are in place within our facility, that community, and then also.
Are eggs over easy okay for you, Jay?
If you are joining tonight, please make sure your device is on mute.
So with that, if Katie's all right, I'll jump into the presentation. And then
go right ahead.
Just to urge you guys to, it's not super lengthy. I'll go through some of the information. If you have questions at any point, feel free to just chime in and ask any questions. The more you guys participate, the better. That way I can get you the correct information or anything that you are unsure about. And if it's something where I don't have the information right now, I don't want to give you misinformation. So if anything, I will make note of it and I'll make sure we get back to you guys. But you don't know if you don't know, so feel free to ask and I'll answer as best I can. So with that, we will jump into it. Katie introduced herself. So kind of what we're going to go through here in the PowerPoint, the outline is some statistics regarding substance use disorder and alcoholism. What is substance use disorder? Some treatment options and facilities around the area, self-care tips and kind of pointers, recommendations for someone. Then also just some resources, and that can be for somebody who might be struggling with that themselves or a loved one of that person, whether that be a family member or friend, coworker. I think statistically they say like 1 in 3 or 1 in 5 people know somebody that's struggling with substance use disorder. And just from my experience, especially being involved pretty heavily in the recovery community the last 6 years, I have found that more and more to be true. It's just a lot of times we don't know because people choose not to speak on it because of the stigma attached to substance use. All right, sorry, I'm trying to move my Zoom thing here. It's blocking what I'm seeing. So some of the statistics here, 10% of US adults 18 and older have a substance use disorder at some point in their lives. and 45% of people in the United States right now struggle with a dual diagnosis. And dual diagnosis is somebody that has a mental health condition as well as a substance use condition. And we'll touch base on it later when we get into the treatment facilities and programs in the area, but there are some facilities that specialize more in the mental behavioral health, and then some that are more just substance use. And then there are also other facilities that consider themselves a dual diagnosis facility. Typically with those facilities, they still label one as a primary health. They consider themselves dual diagnosis, but their primary is mental health. And as Community Fairbanks Recovery Center, substance use, and then like the mental behavioral health secondary. And behavioral health and what we originally diagnosed, a lot of times we will refer them out to a facility for that proper level of care if we feel we cannot provide that. Going back here, so in 2019, almost 86,000 liver disease deaths among individuals ages 12 and older. 43% of those involved alcohol. And that was from the National Institute on Alcohol.
Oh, you're glitching out for a second.
2019, almost 71,000 drug overdose deaths occurred. No, I saw something recently where the CDC released, I want to say it was closer to, it was either 80 or 90,000 overdose deaths. It takes them some time to put that together, but a big part of that from what they felt was due to the pandemic hitting us hard last year. A lot of individuals afraid or not willing to go to emergency rooms, or being told if they don't present as COVID symptoms, or if they don't feel well, don't go to facilities. A lot of treatment facilities that hosted 12-step support groups for somebody struggling. So a lot of this stuff that was going on with the COVID pandemic, could be contributed to that big increase in overdose deaths from 2019 to 2020. And I believe the alcohol related deaths went up as well. Screen's blank.
Oh, so this, I had added a short video. This is a
okay.
video.
I was wondering, I couldn't see it.
Yeah, no, it's a very basic, Dr. Volko. She's like the director of NIDA. And that is a good database that everyone uses kind of in drug abuse and addiction. So that summarizes some things really nicely. You might have to double click it. Double click the black box.
Did not work?
Oh, no. Click it once.
It's black. I see it, but it's not giving me the option to
How did I
play.
do this before? You try clicking a few different ways. I'm not sure. Well, like I said, it's really basic. So I think our next slides would be fine if we can't get it to.
Katie, you
play.
can share if you want to at the same time that he is.
Share
I've got you
screen.
both able to share together if you want to give it a whirl.
Oh, It.
I wonder if it's because I'm back in the presenter view. Should I try and exit out of that?
Yeah, go right ahead. You're sharing the screen, you're sharing the PowerPoint.
Still giving
On
me
a double
that.
click, it just goes to the next slide.
I'm not able to get it. When I double click, it just
Mhm.
changes goes to the next slide.
Well, I think you're gonna cover things just fine, so I think we can pass it. It's, yeah,
Okay,
no
so
worries.
now can you guys see the one now where it says, what is substance use disorder?
Yes.
Okay, so substance use and or drugs causes clinically significant impairment, including health problems, disability. So it's, I would, I mean, I check marked every one of those boxes when I was in my active addiction before I ultimately seeked out recovery and got sober and got connected through treatment. So of substance use disorder, and most of the times when you are going into a facility, one of the first things you do is meet with a licensed clinician who would meet with that individual and go through their questionnaires and asking them about personal history, what's going on. A lot of times a nurse or somebody along those lines is brought in as well to assess them physically and see, and from there, a combination of both that of those is how they kind of put together, the level of substance use disorder, where they can, deem it whether it's severe or moderate or light. And again, for each person, it can be different. And I think a lot of it is based on just gathering that information when somebody comes in for an assessment. And one of the toughest things when somebody is coming in for those assessments and they're trying to appropriately diagnose that is gathering honest and correct information from the from the individual. A lot of times I sat in admissions in the access center over at Community Fairbanks when individuals were coming in, and a lot of times a loved one, family member or friend, somebody like that would come in with individuals and accompany them just for support. And then also we found a lot of times it helped tremendously for our team and staff to gather better information, if that makes sense. A lot of times you have to ask the individual if they are okay with that family member or friend or somebody being in the room while the assessment is taking place. But a lot of times we found that it helped because we would get a perspective from somebody on the outside that can maybe give us a little bit more information. And if the individual declined to have that person in the room, there was also a questionnaire that we asked if that person could at least fill out. So say John Doe did not want his mother and father in with him while he's seeing a clinician and nurse doing an assessment, we would ask if he's okay with the family or his mom and dad filling out a questionnaire while we speak to him individually. And usually that questionnaire to the person who's accompanying that individual to the assessment digs deeper in some of the questions on, where the struggles they're going with. And a lot of it is, a lot of the answers we see are, they haven't been working in a while, their health has gone down, we see them isolating, they financially they've put themselves in a tough spot, their relationships got damaged or destroyed, or they're not currently able to see their kids, or they have legal issues. So again, a lot of times it can be difficult to get that information from the person who is there for the assessment and seeking out treatment. And I think a lot of that just comes with the stigma and embarrassment or shame that they feel seeking treatment. So it can help getting that information from a loved one that is accompanying them or supporting them to seek out treatment. The National Institute of Health believes that stigma stems from inaccurate beliefs that addiction is a moral failing. instead of what, it has been labeled as a chronic treatable disease, which patients can recover from and continue to lead healthy lives. And I see this all the time. And that's why I made the statement earlier where I think it was 1 in 3 or 1 in 5 people that you are around know somebody that struggles with substance use. And I wouldn't be surprised if the number's higher. There are a lot of individuals that don't speak up on their current situation because of stigma attached to it. And I've seen people that are embarrassed or they, feel ashamed that they can't figure it out on their own. They think they can get a hold of this thing. And because of that, they, try to like suck it up and figure it out themselves. And ultimately things can get a lot worse. And it keeps people from seeking out that appropriate treatment because of what others might think, what others might say. A prime example I'll give before I go to the next slide. So there are several treatment facilities. There are some in Indiana and a lot just scattered throughout the US where they have, more anonymity and treatment programs at their facilities. Some might be strictly for judges and lawyers, or some might be strictly for fire and police, where that facility, that is all their program is for. Everyone in there is in that career field. And I think a lot of that is because of somebody, let's say as a judge, who is giving people sentences, or they're coming in on probation or something like that. And then let's say that judge has an OWI or has an encounter and he goes to seek out treatment. He doesn't want other people to know what's going on with him. He doesn't want to lose their job. So there's a lot that can be tied into the stigma. And there's a lot of ways that, resources, organizations, and facilities try to, remove some of those barriers attached to the stigma to really make treatment accessible for individuals. So I mentioned this earlier with the co-occurring diagnosis. That is what I mentioned as a person with a mental behavioral health diagnosis along with a substance use disorder. And then just 2 terms here, or 2 definitions. So the first one is sober, where that is somebody that's, currently not affected by or using drugs or alcohol. And then the second term there is recovery, and that is defined as a process of change through which individuals improve their health and wellness, live self-directed lives, strive to reach their full potential, and a lot of times find what they feel is a purpose in their life. Where a lot of those things, when somebody is struggling with substance use or alcoholism, they are missing a lot of components of that, like health and community and purpose and recovery or relationships. And I see people use those words all the time and differently. And some people, I know have been sober for 25 years. They're not necessarily active in a recovery community, but at the same time, a lot of people look at them as they are in recovery because of them getting sober. It has given them a lot of those things that definition mentioned. Their life has improved, their health, their employment, their relationships, their careers, all those things have improved, although they may not be involved in some kind of support recovery-based meetings. That doesn't necessarily mean they're not in recovery. And I believe one of these next slide kind of touches base on that as well, as just kind of meeting somebody where they're at and understanding that everybody's road to sobriety or recovery is different for that individual. So with the definition, I want to point this out too, where it's called co-occurring disorder or diagnosis. That used to be called dual diagnosis. I think a few years ago when I first started with Community Fairbanks, they would call it dual diagnosis, and it's now called co-occurring diagnosis. Historically, it has been looked at as kind of a black and white approach. As an example, even the term abstinence is not used much in sobriety or recovery, because abstinence from substances means not engaging in anything at all. And a lot of treatment these days is not necessarily focused on complete abstinence. And I think in the next 2 slides, we touch base on that more when we dive into harm reduction and things like that. But as I mentioned earlier, when I gave my introduction, I'm a certified addiction peer recovery coach. And one of the very first day in the training I had to do, Stan Kemper, who ran that certification in that program, the first thing he mentioned is he asked everybody in training a question: when is a person in recovery? And all 60 people in there had, different ideas and answers. People said, when they're not using drugs or alcohol anymore, or when they stop using their drug of choice. And his answer was plain and simple: a person's in recovery when they say they are. It's not our decision to decide when somebody is trying to improve their lives or when they're in recovery or not. That is something that is left up to them. And ultimately, our role working in this field is to meet them where they're at and support them. So if that means somebody is an opiate user and, they refrain from using opiates, but they decide to smoke marijuana, it's not, my role to tell them they're not in recovery or they're not sober or they're not improving their current situation, because in their eyes, that can be progress for them. So some warning signs just to look out for, and this can be coworkers, students, family members, friends, loved ones. A lot of times stress is something that can lead to alcohol use or substances, or anxiety. That's not on here, but I know that is a really big one, anxiety and depression. And a lot of times, I've read handfuls of books on some of this stuff. So, it says, do these people need this to cope? And are they kind of trying to keep it a secret? A lot of times people and it may be something they're not even aware that they developed over time, and it can be a way for them to deal and cope with situations, and it becomes almost a defense mechanism. Although somebody else may not be directly involved in the situation, it can still be kind of a defense mechanism barrier to where they don't have to feel whatever it is they're feeling. That is their way to escape from that situation. Conflicts with family members, friends, relationships, is it affecting those relationships? And this last one, unfortunately, a lot of times it comes to this with individuals excuse me, are consequences starting to present themselves. And in one of the previous slides, I went over some of that, but that can be anything from employment to living situation, relationships, family, custody of children, financially, legally. I mean, that could be in a lot of different ways, and it doesn't always take somebody getting into those situations and having consequences for somebody to seek out help and want to get some treatment or support for their substance use. Again, it's different for each person. Some person's tipping point or what they consider their rock bottom may be a lot different than somebody else's. But if you see any of these signs, or you are worried about somebody else and you're not sure on how to approach that situation, you can always reach out to a professional to get some guidance. And that may be them having, somebody contact you or the family and kind of walk you through how to approach it. There's a lot of different routes you can go with that, trying to approach them with love and care to see if they're open to an assessment. Some people turn to, professionals as interventionists to kind of mediate a conversation between family members, friends, and a loved one. So this one here, treatment options, harm reduction is the very first one there. And that was what I mentioned, I think 3 slides ago, where it talked about the word abstinence is not used much in recovery and treatment today. And that's because a lot of facilities have tried to approach it in a harm reduction matter. And I like the example that we have here, where similar to what I just mentioned, there can be somebody who's using opiates and they still choose to use marijuana. That is less harmful for them. And in their eyes, and even the eyes of, the physician that they might be seeing or the medical director at that facility, they still look at that as success, as it is improving, their current situation. And to help reduce the stigma attached to substance use and alcoholism, we have to understand and accept that that is a better choice for them. And we can't make that decision for them and say they're not in recovery or they're not taking steps forward because they're still, let's say, in that situation using marijuana. A better, or I guess a different approach to an example of understanding that as well too is roundabouts. I know if anybody is up in the Carmel area or north side of Indianapolis, there are a lot of roundabouts now. Those, were put in place. A lot of people run stop signs or don't stop all the way. Traffic accidents were happening. And so if you look at it in that sense, somebody decided, hey, let's just put the roundabout up so people don't have to stop. They can still kind of go through, and it helps reduce any harm in that situation that could possibly still be there if there were stop signs and people were just running through stop signs. So it's just another way to look at that person's current situation. And it's about just creating less harm. And so you have to look at it in the sense of, all it takes is one more time for somebody, whether that be they get in a car and they're, have alcohol in their system and they're impaired and they get into an accident, or somebody chooses to use an opiate or something like that and they overdose. It can just be one time that is their last time, but if they're taking steps for harm reduction, it gives them, to be really black and white with it, it keeps them alive. And it can prevent, the ultimate tragedy in their current situation. The next bullet point there, withdrawal management for treatment options, that would be, what I believe kind of falls in line with like medication assisted treatment programs. So that could be, there's a handful of different medication assisted treatment programs out there right now, but a lot of individuals struggle early on, especially if they've been, consuming alcohol or substance use for years and years and years. That physically can take a toll on you. So even though you may not be putting something physically in your body for 1, 2, 3, 4 weeks, I promise you, I've been through it. You still do not feel well. So a lot of times people go through some of medication assisted treatment to help with that withdrawal management. I remember when I was in my partial hospitalization outpatient programming, it was 3 weeks, 5 days a week, 8 to 5, almost like a full-time job. And my therapist, who is now our outpatient supervisor, I remember him showing me the statistics and the data that if it would take anywhere from 1 year to 18 months for the chemicals in my brain with the dopamine and serotonin levels to get back to normal from my using from when I was in active addiction. And I remember that blew my mind because it at the time I was in there thinking, I'm 30 days sober and I still feel like crap. And I'm thinking this is just one day it's just going to flip the switch and I'll feel great. But then I had to think of it from a realistic perspective that, hey, I was doing this for 9-10 years straight, almost every day, and expect to just feel fine and back to normal within 30 days. And so I went through medication assisted treatment myself for about the first 9 months to help with that withdrawal management, because again, it's just removing another barrier. When somebody physically feels better and the symptoms from that withdrawal are not there and they're feeling better, then it allows them to not worry or stress about that. And they can then focus on the other stuff, which is, receiving the actual treatment and care. And that kind of ties into the IOP, which is intensive outpatient programming. Different facilities have different levels. Some might be, 6 weeks, 3 days a week. The main point I want to make with the intensive outpatient is the individual, they're not at the facility overnight. They're not there for a week straight or 30 days. They have the capability to go back home or wherever their current living situation is. And it's essentially them adding some accountability where they go, and most of the time it's in group settings where it might be 1, 2, or 3 times a week. They are in their group of individuals in the program as well, and then also with their licensed clinician. And as I mentioned, with the withdrawal management, most of the time for somebody to be in that level of care, the physical symptoms and withdrawal symptoms are not as severe as they were originally. So they're able to focus on some of the underlying causes of maybe why, they feel the way they do or what is going on. And then the last one is psychotherapy, and that can be, that can be a lot of different approaches. I know the big one, a lot of facilities focused on cognitive behavioral therapy and addressing, as I mentioned previously, just underlying causes. And a lot of times it can be tied back to anxiety or fear or trauma, a lot of trauma that people didn't realize they experienced or they went through. And, experiencing that stuff years ago and your brain processes it a certain way and you're not aware of it or you don't pay attention to it. As I mentioned earlier in this presentation, it almost compels you to put up these barriers or like these defense mechanisms or way you cope and deal with stuff. And so it's really kind of like digging deep into a lot of those things and trying to pinpoint why an individual reacts or handles things a certain way. One other thing I wanted to point out as well, because I feel this is important, because I feel like it has a lot of stigma attached to it as well. But when the first bullet point with harm reduction, one of the harm reduction things that's grown in the last 2 or 3 years now in Indianapolis or the central Indiana is the needle exchange programs. That is one where a lot of people don't agree with that, but in terms of harm reduction, it is a massive step in the right direction. I know Madison Weintraut, who was she helped start the mobile needle exchange through, I believe it's the Marion County Health Department. And oh gosh, I think in 1 month they collected, it was 50,000 syringes. So if you look at that as 50,000 syringes, those could have been just laying on street corners somewhere for a random person to pick up or use, and that can transmit a lot of diseases. So in terms of the harm reduction in that aspect is huge. And a lot of those individuals who show up for the needle exchange as well, there's recovery coaches there that try to intervene and encourage or urge them to seek out some support and treatment. So I feel like that is a great point, because a lot of people may have different opinions on that, but when you have to look at it in the bigger picture on what it's really doing for our communities and our surroundings, and again, helping keep people alive. So with treatment facilities in, let's just say central Indiana, surrounding areas, Community Fairbanks Recovery Center, which is who I'm representing, and I'm a part of their organization. We are on Community North Campus, right across the street from the behavioral health, and we kind of work in connection with them. And a lot of times there are recovery centers that are not hospitals. A lot of ones that have been around here that are pretty well known and been established for a while now. Valley Vista, Options Behavioral Health. I know it's grown a lot in the last few years. Hickory Treatment Center. And then we've had a few new ones open up that I personally just know really well. I have friends that work there, and we've established good relationships with them. With Community is Landmark Recovery Centers of America, Evolved Indy. There are a handful. And then if you go further south, you have Terra Treatment Center in Franklin. You have Wooded Glen, which is way south in Henryville on 600 acres. So there are a lot of options, and depending on financial situations, there's a lot of options where so a lot of people. I remember when I was first looking at treatment facilities in 2012, almost 10 years ago, half of those places I probably just mentioned were not even around then. And I had to go to Google. I didn't know much about treatment at all, but I think just in the last 10 years alone, the direction that Indiana, that we have taken towards substance use and the opioid epidemic, and not just us, but our country as a whole, I think it's been a big issue that we've been trying to tackle. And I think it's been brought to attention more to the public, and more resources and access to that treatment is becoming available, which is a great thing. The other one too is just if somebody doesn't know the SAMHSA National Helpline, and then I know this just from working as a recovery coach with individuals as well. So if you dial the number 211 on your phone, I can't remember which option. I think it may be option 2, but it's an automated system. If you dial 211, one of the options there will connect you with a live person, certified recovery coach on the phone. And one of the first things they will do is determine your location. So if, let's say, you're Hancock County, or Marion County or Hendricks, they kind of determine your location, because the state of Indiana, I think it's broken into 12 regional hubs. And so once they determine your location, they will then connect you with that live recovery coach for your area, who then can connect you to resources in that region. And those resources could be everything from employment services, inpatient treatment facilities, outside support meetings. That is their role, is to just be there on the phone for when people call in, and direct and help get them to the resources that are available. So remember that 211, not 911, 211. You may, 911 is still an option, but let's start with 211 first. And then also there's the other ones that would be more in line with like a hospital setting. You have St. Vincent's, Eskenazi, and Franciscan, and then adult and child is a big one here in Indianapolis, and I believe Greenwood, that have been around for a while, that provide treatment as well. And a lot of the different facilities offer different levels of potential. So it'd be worth looking into these facilities first to see what services they provide, or at least obtaining an assessment at one of the facilities to see clinically what recommendation they give you for the treatment they feel you need, whether that's detox or outpatient setting. And then this next page here is support groups. So NAMI, the National Alliance of Mental Illness, they have support groups for those with substance use disorder or mental illness, and or those living with somebody struggling with substance use disorder. Al-Anon, there is also Nar-Anon as well, but Al-Anon is to assist family members or friends of somebody struggling with alcoholism. And it is a 12-step program. It essentially is for significant others, family or friends who have someone they know that is going struggling with alcoholism, going through a 12-step program, and they essentially kind of do the same thing on their own. They get a sponsor and they work a 12-step program as well. I've actually attended one and spoke at one before, which was an interesting experience. That a room full of people not struggling with alcohol or substance use, but they are a part of Al-Anon, going through their own 12 steps, and then hearing from somebody on the other side of it. But it was very informative, and I got to see it from their angle and perspective and how they approach the meetings. And it was really, really impactful to be a part of that. And then, as I mentioned, there's Nar-Anon, which is it's essentially the same thing as Al-Anon, but instead of a support group for family or friends of alcoholics, is for somebody struggling with substance use or narcotics. But there are a lot of other ones. There's Overeaters Anonymous, there's Gamblers Anonymous, Narcotics Anonymous, Cocaine Anonymous. There's one called Codependency Anonymous, and that is not even necessarily related to anybody struggling with substance use or alcoholism. I'm trying to think of what else. There's a lot of grief and support groups as well for somebody that may be going just the loss of a loved one, even if it was not related to alcohol or substance use. So really, there are all kinds of support groups out there. And then one here called PALS. I had mentioned this to Katie. It's called Parents of Addicted Loved Ones. They do a lot. I see them at a lot of events and just getting out there, trying to be kind of a resource for individuals that may be going through that with one of their children or spouse. And you can find off the top of my head, I'm just trying to think. So they're in Hancock County, they have Healthy 365, where they're kind of like a community resource center, and they help people connect to support groups. There's one in Columbus. I'm drawing a blank on the name, but if you look in your specific county, more and more they're opening up what they just kind of call like a community support center, and they don't provide any kind of treatment themselves. If anything, they may have a recovery coach, but their role is just kind of directing individuals to the right support group or services that's needed, whether you are struggling with alcoholism or substance use yourself, or you know somebody that is. We're wrapping up here. I'm trying to get through this. So these last ones here, just self-care and coping skills. I mentioned earlier, a lot of times people struggling with substance use or alcoholism, they almost subconsciously start to develop these like unhealthy coping skills or behaviors that they are not aware of, or if they are aware of, they're, that mental obsession of their substance use and alcoholism has gotten so strong that they keep going down the path that they're doing anyway. So I remember my physician telling me this, one of the like best things you can do when you were early on in sobriety or trying to get there is exercise. Your body, naturally producing, just dopamine. It's like getting excited, and it might feel not so great at first if you haven't done that stuff in a while, but I promise you, like once you get going, it helps out tremendously, and not just like physically, but mentally as well. It can help take your mind off things and clear your head. I mentioned this to Katie too. I know people that they keep a list of like 10 things, and they just put it in their wallet of 10 things they can do anywhere right there on the spot. So if they ever find themselves in a tough position, or maybe they're having a thought to go do something they shouldn't do, they pull out their wallet and they look at the list, and it can be drop down and do 25 push-ups. It can be pick up the phone and call somebody. Whatever that list is, just something they can do right then and there, because if you're having some kind of thought in your head, if you can even just find anything to kind of alter that thought and get your mind off of it, sometimes that is all that's needed. And that's the second one on there, call their friends. And, a lot of times that person on the other line, it's not like they say anything that's, monumental. A lot of times we just need to get it out, just verbally get it out of our head and say it. And a lot of times just by doing that, it doesn't have as much power on us anymore, and it's not affecting us as much. We just need somebody there to answer the phone and listen sometimes. Art or music therapy is a big one. There's actually a lot of treatment programs where they have art therapists who come in. I know we have one at Community Fairbanks. I know Landmark Recovery has one. I think Evolve Indy. So a lot of facilities more and more are bringing in or incorporating art therapy within their programming, even if it is maybe just one day a week for an hour. It's just a different approach, and it can help boost people's spirits and just get them out of, like digging into past traumas or behaviors. It's just a different way for them to kind of let loose and enjoy themselves. Taking a class or online, just really just trying to find things you might enjoy, or things that you maybe enjoyed in the past that just got away from. Reading books, meditating, taking a nap. That's always a good one, even still today. And garden. I don't know if it's still active, but I know we have an area outside our facility where at one point we were allowing patients to go out that were in our 30-day program, and there's a garden out there. A lot of other facilities have that as well. It just helps them feel like they're involved in something. And again, it's a different approach to a typical like structured day of groups and programming and things like that. So anything to kind of spark interest or give them excitement, because for a lot of times, if somebody's struggling with this for extended periods of time, a lot of their daily activities are related to, alcoholism or their substance use. And so for them, it's almost like they have to start over and figure out, okay, what do I enjoy again? Because for a long time, this was what my days revolved around. I mean, I had to do the same thing when I got into recovery. I got away from so much stuff that I had to almost just start from scratch. And I just started trying to do all these different things to try and figure out what it was that I enjoyed again. So anything that, comes across as a productive or healthy exercise or coping skill, because it is much more beneficial than some of the negative behaviors and coping skills that people were using previously. And I think this last slide here is just some more resources. Allies in Recovery. It's a community reinforcement and family training that they call the CRAFT program. It's an evidence-based program that 50% of people suffering from substance use disorder and who admit they have a problem are resistant to getting help. And I would find that to be pretty accurate, that percentage. And the CRAFT program was designed with these people specifically in mind to help family members or friends, loved ones, improve communication with that person who is struggling with their substance use. And the bottom one there is just some additional support groups. And we touched base on that a few slides back. On this next page, for you guys with your EAP through Lawrence would be with Lincoln Financial Group. And I've utilized, I think, every place I've worked, since I got out of college. So the last, 14 years, I didn't even know what an EAP was, 14, 15 years ago, like fresh out of college from IU. But the more and more when, I've switched employers or looked into that, like take advantage of the EAP. That is what they are there for. That is an additional benefit for you guys. And sometimes they have stuff that you might not even be aware of. I went through a situation 4 years ago and was unaware, but I reached out to the EAP and found out they provided, it was like 5 or 6 free therapy or counseling sessions. And then after I met with the individual counselor, they decided they wanted to try and get me approved for more. And they sent a request in, and I ended up getting 12 sessions at no charge, no cost. And it, was financially, it was nice. It helped. And just the treatment, counseling itself helped tremendously. So again, some of those resources that we mentioned in the previous slides, if you guys are looking for that as well, you can always reach out to your EAP and they should be able to point you in the right direction as well. And then these next 2 slides, I won't go through all of them. It's just websites and resources that you all can check out yourselves as well. And some of these links here are where Katie, I should say, pulled out some of the statistics that we used early on in the presentation. I think I tried to be done by 6:45. I went a little over, so I apologize. But do any of you have any questions or any information that maybe you would be interested in? Or Katie, do you have anything to share following the presentation?
No, I think you covered it very, very well. I definitely encourage people, if you have a question right now while we got an expert, you can use the chat or just unmute yourself and share. We're happy to answer questions.
Don't be shy.
Do appreciate your time today. Thank you so much too, Matt, for being with us.
You're welcome. Thanks for letting me be a part of it.
Sometimes you may get a couple things in the chat too, if you want to check that.
Oh yeah, sorry, I'm on the.
I just pulled it up. We got another thank you. Good job.
On the presenter mode, so my chat disappeared.
It is very hard. Yeah.
Oh, exit out. Okay.
And Matt, can they reach out to you directly if anyone has questions on the side that maybe want to ask it?
Absolutely. Can I put my email in the chat and just send it to everybody?
Mhm.
Yeah, that'd be
You-
great.
You could probably stop your share now and then you'll see your
Oh,
chat.